Hi, Dr. Gartner here, back for more questions about the BBL. So we're going to answer more questions in just a few minutes, and we're going to get right back into it. All right, so welcome. Thank you for attending. So we have a few more questions on the BBL we want to finish up on. These are some of the most common questions people ask. So the next one is, where will my fat be extracted from? So you can get fat from anywhere you traditionally do liposuction, but most commonly for the BBL especially, to get nice shape all over the torso, I like to do it from the abdomen, snatch the waist, and then get rid of the bra rolls if possible, and those rolls underneath the arms. That way we create a beautiful V shape, and then we enhance the buttock by putting fat in the buttocks to create the most amount of shape. You can take it from your arms, your neck, a little from your inner thighs, but usually that midsection, along with the silhouette of the buttocks, gives you the best results when you do liposuction, abdomen, waist, and back, and then transfer that to the buttocks as well as the sides to sometimes fill in some hip dip issues to create that nice round look. Okay, on to question 2. Should I expect a lot of scarring or bruising? Well, you'll have a few liposuction scars. They're about the width of my pinky. I usually put 2 on the lower part of the abdomen, 2 on the sides, 1 up here, and then one or 2 on top of the buttocks. And basically they're small. Most people, they're hard to see, but occasionally someone 3 or 4% scars a little thicker, and then we have to do a few laser procedures or injections afterwards to make it better. So even if you do scar a little bit, we can make them better. Okay? As far as black and bruising, you can get bruising. I've seen people with no bruising, and I've seen people with a lot of bruising and everywhere in between. It's kind of an individual thing. Usually the worst happens the first 2 or 3 days, and then it turns all different colors and sometimes takes a few weeks before it completely goes away. All right. Let's see, the next question is, what is the difference between a BBL and buttock implants? So both augment the buttocks. With the BBL, we're using your own natural fat, your own natural material, while implants, they have this elastomer, full thickness silicone implants. They're kind of hard. They're put in through an incision in the midline, and they're usually put either on top of the muscle, subfascially, or in the muscle. They really only augment the top part of the buttocks. They don't fill in hip dips, and they don't take care of the lower part. And there's only a certain size you can put in. So the problem, I used to do implants a lot years ago before I was doing fat, and then I switched over to fat. The problem with implants a little bit is that small implants work, but nobody wants a small implant. So the problem is, the bigger the implant, the more the problems. You can have the incisions open up, you can develop fluid around the implant. I've had one patient where it kind of went through the skin and caused a problem there. And and some patients, if you put a big enough one in, you can have pain when you're sitting. So you don't have any of those problems with fat. Fat has minimal risk, and so fat is easier. You can put it all over, and it's your own natural material. Okay? Who's a good candidate for a BBL? Well, you have to have some fat. We have the so-called skinny BBL, where basically we have to take fat from multiple areas. You have to be realistic about the expectations. They're not going to get a huge S-shaped curve with that. They'll get some improvement. Sometimes they get to look like they've been working out and had Pilates done, which is fine. That's all they're looking for. But if you don't have a lot of fat and you have a lot of issues, then it's going to be hard to address all those issues. On the other hand, there are patients who are too much overweight. They're just too obese, too heavy to do the surgery, and basically they need to lose weight before the surgery. So either way too skinny is no good, or way too heavy is no good either. So somewhere in between is just right. Okay, so that's what we have for now. Once again, list more questions in the comment sections, and we'll get into them. Make sure you hit the subscribe button, and we're looking forward to talking to you again.